Well, Adnan, it's great to have you here. And thank you for joining us. And thanks for the wave. We're excited to do this really quick conversation with you, understand a little bit about the problems you're trying to solve. What are you doing with Luma? What are you excited about? What results are you seeing, and so on? So let's start with you. Tell us a little bit about you, your role, how long you've been doing this, and just to get acquainted.
Okay, awesome. Well, Sonia, always a pleasure to hang and you and I can chat for hours on end. So
Yeah.
excited to have our 15 minutes of like quick hitting action here. So Adnan, one of the founders and the CEO here at Luma Health. We are headquartered in the San Francisco Bay Area. We've now been around for well over 10 years, and we partner and work closely with a little over 600 health systems, hospitals, clinic networks all across the United States today.
Wow.
We'll add our first Canadian health system partner later this year, and our first UK health system partner sometime in 2025. So a lot of shared problems there, but to date, like our core focus has been working hand in hand with leading health systems, hospitals, clinic networks here all across the U.S. and really helping them solve their sets of challenges in terms of the healthcare consumer, right? And really be able to orchestrate an entire end-to-end journey for their healthcare consumers.
Well, congrats firstly on the great progress and the reach that you've had and the international expansion. But tell us about core problems. You can, this idea of start with why. Why are you doing this? What are the core problems in a simple way that you're trying to solve for? And why are these problems important?
Yeah, no, great question. Look, you're the chief insights officer, so you cover a lot of the different pain points, challenges, inefficiencies in healthcare, and there's lots of good folks tackling all the different varieties of that. Look, for us, it started with a super simple experience, something that I experienced firsthand as a patient. One
Mm.
of our other founders, Dr. Tashfina Karan T, because he was my college roommate as an undergrad at Berkeley, he experienced as a physician and it passes the mom test in simple English. It's just needing healthcare can be hard, but getting healthcare isn't, right? Sorry, needing healthcare can be hard. Getting it should be easy, but it isn't for most people, right? And we live that firsthand, me as a patient. And he sees that all the time as a radiologist, where he has people trying to get access to care, right? And they really, really struggle. And so that's like the little, core nugget that we started with. And when we talk about needing healthcare can be hard, getting it should be easy. I'm reminded of what you've now covered and written about in terms of like really radical reinvention, right? And I think we applied that directly here to all the stakeholders, the patient, staff
Yeah.
members, and the provider. And we know there's growing demand for healthcare. So how do we help more people? And I use the word people here on purpose, not patients. How do we help more people get to the right healthcare with the right provider in the right way? Faster, and so that they keep coming back, right? So that we get to the desired outcomes, all the things that we know we want to achieve and that our health system partners want to achieve. But how do we do that in a thoughtful way that benefits not just one of the stakeholders, but really, really changes the way that a healthcare consumer, their experience really automates workflows for staff, right? And also helps retain staff because it's making their job easier, better, helps them have more time to connect with the actual patients and care. And then, of course, from the provider side, right? How do we ensure that there are no mistreatment opportunities, that they're able to get people to the right care and keep coming back for the care? And care doesn't just mean an appointment, right? Care can be an answer to a question. Care can be some sort of follow-up, but often it does mean like physical care. But how do we make that really just a stellar experience for all the folks involved?
Yeah, I think you make such a good point about given how advanced medical technology is and advanced medical care is,
Mm.
and in this country, access is still a challenge. It's a big challenge. We talked about this 10 years ago. We're still talking about access is a big challenge in big cities, in underserved areas. It's a challenge. And that right care, right time, right place problem is also important to solve for. So tell us about your solution. What are you doing? How is it different? Tell us a little bit more about Luma.
Yeah, I'm going to quickly just piggyback what you said. I think uh, we've been at this for 10 years, and it started off like as a smart wait list, right? The way to find people who are waiting for care, who are scheduled weeks to months out, and finding availability in a clinic schedule, and then making that magic happen. We were able to get people in sooner because I canceled, you canceled, someone else canceled, right? And so it was the early days of scheduling. People didn't even use the word access yet, right? And so Elizabeth Woodcock, who I'm sure you know, like at the Patient Access Collaborative, like the umbrella group of all the different academic medical centers. I want to make sure I get this right. I wrote this down. She articulates this perfectly. She's like, patients are fighting to get into our systems, right?
Right.
And so like that, like my heart just like that
And
hurts,
the
right?
burden, the
And
burden is on them to navigate it. Yeah, yeah.
exactly, right. And all of us have been our own success champion, where we have to navigate all these complex interactions, and you have to advocate for yourself. And it can be something as simple as getting a physical therapy appointment, right? Like it's really, really hard. And then if we think of like all of us as people and consumers, like we enjoy ease and some automation in every other aspect of our life, and like here we still don't have it. So you asked about our solution, and so we talk about Luma as the healthcare consumer success platform, right? And it starts with success. And again, success, we've all been our own success champion. We've had to navigate, call, do what we need to do to, climb walls to get to care. And we really think, I really use the words purposefully in terms of consumer success, because we're all consumers. We all have more and more choice, and we're all for paying for more and more of our healthcare. And I don't like the word patient engagement, right? Because none of us want to be engaged. We want to be helped, and we want to get to success, whatever success means for us. Success could mean I got an appointment quickly. Success could mean I understand what it costs and I can afford it. Success could mean I did it from home, like I did a virtual appointment. Success could mean I got into the doctor I wanted to see for a specific procedure, and I didn't have to wait months. I was able to get in within days or weeks, right? So we all have different definitions of
And you
success.
all used, assume some like consumer research to inform that success means all these different things,
Absolutely.
not just getting a visit, right?
Absolutely. Absolutely. And so all of us like success can mean different things for us, not just as an individual person or consumer, but also in types in the different types of care we need when we need
Mm.
it, right? And
Right.
so Luma's platform, and look, everyone will use the word platform. Like 10 years in, it is a platform, right? And we've been lucky. We haven't had to pivot or change our direction. But what Tashveen and I experienced with Ditya, who's our CTO and our technical founder, like what Tashveen and Ditya laid out the product and platform vision, we've been lucky. We haven't had to pivot from that. And it was really simple. It's, needing healthcare can be hard. Getting healthcare should be easy. Okay, how do you do that? Well, you really need to unify and automate the entire consumer experience, right? Which means for us, from a product standpoint, that means access, right? Scheduling, rescheduling, got all the versions of scheduling, new patient, existing patient, follow-up care. Oh, I have to cancel and reschedule, like every version of scheduling. So that's access,
Yeah.
communications, right? Because there's a whole host of communications, and communication doesn't mean a reminder. Like it means this is active, intelligent conversation with the patient on their preferred device, on their preferred channel, in their language, right? So like 40 languages out of the box. And then
And that important
readiness.
you said that is like automated intelligent communication. So it isn't dependent on a nurse or care manager doing your orchestrating some of that.
Exactly. Yeah. So access, communications, and then readiness. Readiness is like making sure that we show up for our appointments, right? That we've registered, we've completed our intake, we understand our eligibility, our insurance, that if we have to pay for something, we've paid for it. So making that all streamlined. And it's interesting, you've covered this space for a long, long time. I think healthcare has often taken a best in breed point solution approach. Is that I have a messaging solution, I have a clinical guiding solution, I have an intake solution, I have a scheduling solution, I have a payment solution. And really, we've seen we were like, hey, that's not going to last in the long term. And so we're good product nerds and have kind of stuck with it being a product-led company. But we've seen the market really shift over the past 3.5 years, which is people are saying, hey, I have my core systems of record, my core health IT stack, right? Which is my electronic health record, my call center, my CRM, my revenue cycle tool. And really what I'm missing is a platform that sits on top and can integrate deeply. And people, the market's smart enough now. They understand, like CIOs and CTOs and frontline staff understand really what's technically integrated and what's more vaporware. So deeply integrated and is a consumer-faced system of action that has all the different touch points I need with the consumer at any given point along their journey. So I'm not managing like 10, 15, right, even 8 different solutions, but I have my core stack and a new partner or a well-orchestrated partner that can allow me to help a consumer navigate that entire journey. So that's Luma. That's what we do. And again, the products are under the buckets of all things access, all things communications, all things readiness.
And how are you selling this to health systems? Is it the full package? Is it piecemeal? how do you have health systems engage with you on this?
Yeah, great question. Right. And so it starts with what the priorities are for a health system, right? Again, I think good news, technology is not new, like digital is not new, right? We use words like access, engagement, digital front door,
You've been saying that for a while. Yeah.
right? Like
Yeah.
it's not new, which is great because we find that our partners at health systems, like be it a CIO, a CTO, CMIO, we're saying marketing often become involved, the CFO, right? The operational team, the ambulatory team, like all these folks understand software, they understand technology. And so they'll know like, okay, like what are my highest priority pain points? What are like the high impact use cases that I have to solve for? And the power of the platform is because it's all homegrown, it's like built internally. It deeply integrates with all the EHRs, right? So Epic, Oracle,
And that's
Meditech,
an important
eClinical, et
piece.
cetera, et
Yeah.
cetera. It integrates deeply with the CRM, which is almost always Salesforce. It integrates deeply with their call center software, with their revenue cycle software. So they know those bits and bobs, and they're looking for the overlay, and they'll start with these Luma Lego blocks, and they can assemble them in the way that addresses their highest priority use cases. Most commonly, that's going to be a function of access, like scheduling, and the and can vary, right? It can be an element of readiness, it can be an element of communications, it can be an element of being able to have like AI-enabled workflows for staff in the call center, right? So the and will vary, but everyone across the board is looking to deliver a true healthcare consumer experience, which starts with scheduling, right, in some shape, way, and form. Like inevitably, it'll lead to a scheduling interaction. And so if we can make that smooth, easy, automated, that allows us to do all the other workflows that we touch upon before, during, between, and after, wherever a patient is in their care journey.
And it makes so much sense because I think you're solving for the issue of the point solutions, integration with the EHR, also making it easy for technology leaders, CIOs with the integration piece, because that's going to be so important, and the workflow
Absolutely.
automation.
Absolutely. And so you remind me of something important. Not all EHRs are the same either. And so our focus is always, we're not going to replace the EHR. We're not going to replace your call center, but it's better together, right? And better together for a sophisticated health system like Virtua Health that uses Epic, has a robust call center, really has some very dialed in workflows. Like for them, better together means something very different than, say, a federally qualified health center, right, in New York that is size-wise quite similar in terms of the patients. They serve a very different patient populations. And these guys use eClinicalWorks, which is obviously not a very open system as compared to, say, an Epic. And so like same problem sets often, but in terms of how do you manifest real solutions and real automation for all three stakeholders, patient, staff, and providers, can be very different. So that's what your question, like how do people buy? Yeah, most of our customers are full platform buyers, right?
Got it.
But many will start with a set of 2 or 3 or 6 capabilities and then expand to the full 30, 40, 50, depending on whatever their use cases are.
Well, that's fascinating to have a partner that you can grow with and expand with over time. Knowing that this is a space, whether you call it consumer success, engagement, it is crowded. What do you see as the key differentiators for Luma?
Yeah, I started touching upon it. One I think is we've been lucky, right, where we had this view that there will come a time where health systems and clinics and hospitals will want a full end-to-end platform, and I think that is true now. That wasn't
Right.
always true. We launched the company 10 years ago. That wasn't true, kind of in the
People were ready to buy bits and bobs. Yeah. Yeah.
exactly. So that is a core area of strength. This is a well orchestrated, homegrown, end-to-end platform, right? And it has, if you think of a health system that's mapped out a consumer journey, and every single one has, either they've done it themselves or hired a consulting partner to help them map that out. Then they think through, okay, here's my tech stack. What do I need to be able to do to check off like all the different touch points along the journey, right? Be it
Yeah.
access and operations, clinical, financial, like whatever it is, right? And so that's where we have the most complete offering. And it's real, right? It's not cobbled together by certain acquisitions, or it's not a story we tell. It's like it's real. It's, if you want to, we have 30 to 40 different Epic customers who use it in a variety of way, 30 to 40 different Oracle customers in a variety of way. Same is true in eClinicalWorks and NextGen and Greenway and Meditech. So there's someone like you in some part of the country who's already assembled the Luma Lego blocks to solve for their challenges. And so it's very real. That's part one of it. Part two of it, I would say, is in the terms of the differentiation, is folks are pretty smart, right? They not only want breadth of offering, they also want real depth, right? And
Mm.
depth is one, like, is this real integration, right? Is it API first? Is it modern? And then they want the ability to have depth in the sense of like, is this really going to automate workflows, right? Or is my staff going to have to like do multiple things, right? And truly automated workflows means it's embedded and lives inside your EHR, right? And we're able to deliver that.
Okay.
True automated workflows also means for a sophisticated organization that's like done blocking and tackling, take like a Montefiore, right, in New York, a leading academic medical center. Just like they hired an Epic analyst, a Salesforce analyst, they have a Luma analyst, and that person's able to configure and assemble the Luma Lego blocks to tackle whatever nuanced workflow they're looking to solve for, maybe in a specific service line. So that ability for folks to like also co-create and co-design through configuration and like dialing things in, that becomes really, really powerful, where
That's
you don't have to
great.
go, you don't have to like do a new build, a custom project, right? Like CIOs, they want to be tech first. They want to leverage their existing tech stack and solve for the problems of today and the problems of tomorrow and 2, 3, 4, 5 years from now. But they also know, like, man, if I'm adding implementation work, um, thinking of change management, having people have to manage more technology, like that's a problem. And so the power of what we can offer is like you get to de-implement. Like CIOs love it, right? They're like, wait, I get to replace this with Luma. I have a
Totally.
complete offering, and my team can self-configure and co-design. Like that's usually magic for them. And then you combine that with the CFO, who's obviously a very important stakeholder now, right? They love to see top line revenue growth, right? Increase patient acquisition and retention. So like helping people get in, make sure people keep coming back, and that they're maximizing utilization in the right way in between their care episodes. So like really, really powerful, tangible metrics.
That
And
actually
then of
gets
course, the last thing I'll say is like the
again
operators, they love time hours, hours saved
for
in their day,
for
right?
sure.
And
Yeah.
so again, all stakeholders benefit, and that really has been within our sales.
I think you started alluding to what I was going to ask in my last question here. From a metrics, KPIs,
Mm,
our standpoint, do you have examples of where you've worked with the health system to see like real
yeah.
metrics move? What does that look like? Can you share
Yeah,
any?
11 years ago when Tashveen and I were like bright-eyed nerds on campus, we got some great advice, and that was like, hey, whatever you do in healthcare, especially if it's delivery organization facing, like drive top line revenue, right? You absolutely must improve outcomes, improve efficiency, drive a better experience for all the stakeholders, especially the patient, right? But if you can show the top line increase in revenue, like that really drives adoption, and we took that to heart, and so pre and post Luma, a typical health system will see a 50% increase in their top line revenue. That's a function of people getting into care and people sticking with their care plan and then coming back for their follow-up care, right? Now, that can manifest itself in a variety of different ways, but that's scheduling, access, like at its core. And
Very
so
impactful.
yeah, and
Yeah.
so real examples of like from with like organizations that deserve a shout out, right? If I think of Mainline Health in the greater Philadelphia area, a really cool use case. So they saw that they were getting a ton of inbound phone calls specifically around mammograms and DEXA scans, right? And so they offered their customers, their patients, an ability to, when they call in, to quickly switch to a text-based conversation, right? And so that ability to like avoid waiting on hold, avoid having to say the same thing again and again, like nearly 55% of their patients like chose to continue the conversation over text. And that became a fully self-service scheduling flow for them. And so like the patients loved it. It led to, millions in dollars of increased revenue for them because people were getting scheduled themselves.
That's right.
And then from a staff standpoint, I mean, this was over like a 9-month period. It was like 900 hours of staff time saved because those were not calls that people had to take.
All
So
due.
instead of now spending 90
Yeah.
seconds with hundreds of patients, you were spending 10 minutes with the patient who you really need to spend 10 minutes with, right? So like
Mm.
really, really, really tangible example there. Another group that I'll call out is Virtual Health, right? I mentioned them. So uh, they they focused on colonoscopies, right? And um, everyone needs a colonoscopy at a certain point in their life, right? Like, and none of us want to do it, like, not
Yeah.
fun. I haven't gotten there yet. Like, I'm in my early 40s, but I'm sure it's coming. And so they were already, but again, like sophisticated, thoughtful health system. I'm sure you know TK and the team. They were automating outreach to patients using my chart, like, using the tools at their disposal to get people into a scheduled visit. And what they found is, hey, we actually don't need a scheduled visit. Like, why don't we proactively send out a Cologuard home test to our patients, to the patients who are eligible, like not everyone got it, and then have an automated set of conversations with them that educate them, like let them know you're going to get this thing in the mail. Here's why it's important, drop in a video of like your provider telling you why it's important. And what they found is people did it, like not everyone, but they had a really strong response rate. People did it at home on their own time, and they were able to then proactively capture a few hundred cases of people who were precancerous. And then that led to a scheduled appointment. So instead of saying like, hey, I have to get everyone who's eligible into the doctor's office, and then, all these things have to happen, it was like, let's make it easy and meet the healthcare consumer where they are and make it easy for them to do what they need to do. Right. And for those who then needed to actually get in and see the specialist, they were able to do that, but they were able to do that in a very, very seamless way. So a couple quick examples of, again,
Yeah,
all stakeholders benefiting, right? The patient, staff, and then of course the providers in terms of being able to deliver the care that they want.
those are great examples, and it goes back to the beginning of our conversation of the right care, right time, right place, but actually also seeing some of the real metrics
Mhm.
that work with these health systems. So, well, this was a great conversation. Thank you for being here.
Of course.
There's more to learn about Luma. Reach out to Adnan, more about Luma on Avia Marketplace as well. So thank you again, Adnan.
Yeah, of course. Look, huge fans of you, Sonia, and the Avia team. So always happy to nerd out about all things healthcare. But hopefully this is exciting and fun for your viewers and members.
Thank you.
All right, we'll see you guys.